Manual lymphatic drainage, or MLD, is probably one of the most well-known aspects of lymphedema management. However, I do feel like it's a little misunderstood sometimes. So let's talk about the technique first. It's a very light, rhythmic touch, and it follows the direction of your lymph flow. It's very sequential, and I like to use the analogy of if you have a clogged pipe, you're going to snake it out first before you flush it. Otherwise, it just kind of gets more compact and it won't drain appropriately, because this allows appropriate fluid movement. And then your certified lymphedema therapist should also teach you self-massage for maintenance. At the clinic, once I train somebody, I always actually let them know that you can make this a part of your daily routine when you shower or dry off or put lotion on. It's actually very simple to do on a day-to-day basis. But what's the difference between MLD and a deep tissue massage? Well, lymphatic drainage is that very light, superficial, rhythmic massage. It follows a certain sequence. It does require that certified lymphedema therapist training, 135 hours. It's not a weekend course. And it differs because a deep tissue massage is trying to get to the muscular layer or the fascial layer versus trying to move fluid and toxins out of the body. If you think about it, you've probably had your partner try to do a trigger point release somewhere on your maybe shoulders at one point. So that's kind of considered a deep tissue massage. There is a little bit of controversy around these compression pumps. If you actually go back to the slide that had the two circles that combined phase 1 and phase 2 CDT, you'll notice that they took the compression pump out and added manual lymphatic drainage. Another little soapbox alongside prophylactic compression. So please check out the video in the longer series for an actual evidence-based response to how you should manage this. Now, I really need to mention, sometimes a pump is appropriate, and that's where your trained CLT, certified lymphedema therapist, comes in, because they have the knowledge and the background to know when is best to use it. So we're almost done. The last pillar of lymphedema management is that skincare, which then we follow up with education and self-management.